Good morning. My name is Paul Newhouse, and I'm Client Services Coordinator with Celltex Therapeutics, and I will be your host for this morning's presentation, Episode 3 of Celltex webinar series, Celltex and Hospital Galenia, a Superior Experience. As the title implies, the focus of today will be more so on the experience that we provide to our clients as they go throughout the stem cell and banking therapy processes, all the way through traveling down to Cancun to Hospital Galenia for stem cell therapy. So less on the facts and figures and science that we've covered in past presentations, and more on just how we put our clients at ease and make them feel comfortable throughout the experience. So I'll start the presentation at this time. So again, the title of today's presentation, Celltex and Hospital Galenia, a Superior Experience. So today, we'll introduce you to the client services team here in Houston, the team that expertly guides you throughout the stem cell banking and therapy process. We'll also introduce you to the team in Cancun, Stem Cells Cancun Client Services, the team that provides exceptional support while you're in Cancun receiving your stem cell therapy. We'll introduce you to the clinical staff at Hospital Galenia, the physicians that deliver superior care while you're receiving your stem cell therapy, as well as give you a glimpse into Hospital Galenia, the facility itself, and some of the reasons why we've chosen to work with them as our facility. And lastly, we'll answer a burning question that's likely to be on everyone's mind, if not already, by the end of the presentation. Before we get started, I do want to point out that this presentation kind of piggybacks off of past presentations we've done where we've addressed some of the questions people should ask before they've even begun the stem cell therapy process, some of the questions that you can ask a physician offering same-day stem cells or a physician offering some type of donor stem cell therapy. You've answered those questions. You've realized that Celltex is really the company that can provide good answers to these questions and back up our process. And then you've also gone through banking, those enrollment, blood work, and extraction steps. And you've come to a phase where you ask yourself, what comes after banking? And we're really talking about stem cell therapy. So just to frame things a little bit, that we'll be talking about stem cell therapy and that experience, as well as Hospital Galenia in Cancun. If you happen to miss our previous webinars, don't worry, please stay tuned. You'll get a lot of good information in this webinar, and at the end of the presentation, I will provide some more info on how to access and view our previous webinars so you can get that great information as well. So first, I'd like to start by introducing our client services team here in Houston. I think it's very important to put faces to names. When you call into Celltex, you may get initially someone else answering the call, but when you get a call back, you're likely to hear from either myself, Paul, Valerie, or Robert. And I'll introduce Valerie and Robert here in a second, but first I'd like to start with Candy Eller, our Vice President of Client Services and Mexico Operations. Candy is actually the one who began the client services well back at the inception of Celltex back in 2011. And she has done extensive work to build our department and ensure an exceptional experience and a superior experience for our clients, both here in the US and in Mexico. She is fully bilingual in English and Spanish, and she has been crucial to forging our relationships with regulatory agencies, Hospital Galenia, who you'll hear about more in coming up here, and our physician team at Hospital Galenia. She also manages Stem Cells Cancun, which is a Celltex subsidiary down in Cancun, which encompasses both client services team down there, clinical staff, and our lab staff down there. And maybe most importantly, what Candy has been instrumental in is establishing our permitting in order to legally import stem cells into Mexico for stem cell therapy, as well as establish our clinical protocol through COFEPRIS, which is Mexico's equivalent of the FDA, enabling us to offer stem cell therapy as we do at Hospital Galenia. A little bit more information about Valerie Young. She is one of our seasoned client services representatives here. She has over a decade of experience working with physicians and in the medical field, and she holds a Bachelor of Science in Psychology from Texas A&M University. Robert Potts has over 20 years of experience in the medical field and medical sales, and he holds a dual Bachelor's of Science degree in Business Marketing and Business Management from Texas Tech University. Another little detail about Robert is he actually started off as a client of Celltex. I won't go too much into detail, but had a very specific medical condition that was causing him to have some seizure activities, basically had to stop working. He came to Celltex. The therapy had such a profound effect on him that not only was he able to resume his career, but he chose to resume his career with Celltex because he believes so greatly in what we do. So I'm very thankful to have him. And last but not least, Margaret Banda, whose name you see at the bottom there. She's not pictured on screen. She's our banking coordinator, and she is the one who picks up slack in a lot of different areas, but really coordinates those banking steps in getting people their blood work scheduled for their extraction and in preparation for the trip to Cancun. Now, what we do in client services here in Houston is we provide expert guidance. And in doing so, I think we have two key roles, those being of an educator and a facilitator. So as I mentioned, when you call into Celltex initially, or you send us an email, or however you get in touch with us, you may hear back from someone else initially or someone else who picks up the phone. But in the majority of cases, myself or Valerie or Robert will be the one to call you back, go through that initial Q&A. You know, the stem cells have changed a lot in the past several years. And we certainly have a much more educated public that we deal with now. So a lot of these questions are much more sophisticated than they used to be. But for those who really have no foundation, we're happy to walk them through what we call Stem Cells 101, some of the basics on stem cells and what they can do for you, the steps in the banking and therapy process, and then just talking about more about what stem cells can do for you and your particular condition. And then you see there, what about this, that, or the other? And basically that just means we get a lot of varied questions, a lot of questions about other stem cell options, other stem cell companies, and just kind of the key differentiators about what sets Celltex apart from those. As far as being facilitators, we do also help with medical review and evaluation, which we do for every client considering stem cell therapy, and that being connecting them with our medical team and helping conduct that review, whether it be review of x-rays or MRIs, blood tests, physician exams, whatever medical records tell the story of what's going on with your medical status. We can have that evaluated, establish your candidacy for stem cell therapy, and get a recommendation for what therapy or therapies may be appropriate for you. There's always ongoing Q&A. We understand that not all the questions will come up at the beginning, so we're there with you basically every step of the way from once you've established first contact. We are your rep moving forward. With Margaret and your client services coordinator, we can facilitate those banking steps. We can help you get scheduled for stem cell therapy, and then we can help provide you some travel tips and suggestions for when you go to Cancun. We have some hotels that we work with in Cancun through which we offer discounts and just some other travel tips. So when you go to Cancun, you're prepared, you know what to expect, and you're comfortable with the whole process. Stem Cells Cancun Client Services, Eduardo Gonzalez and Veronica Sosa. These are the friendly faces who you will see most when you get to Cancun, and the ones who will serve as your client services representatives while you're there in Cancun. So you have someone to go to. The client services team in Houston is still very hands-on. We're always just a call or an email away, but this way you have someone there in Cancun should you need something. And what I would say about the Stem Cells Cancun Client Services team is they provide exceptional support. They help coordinate your transportation, picking you up from the airport, taking you to your hotel, from your hotel to the hospital and back for your appointment or for multiple appointments, depending on what your regimen calls for, and then picking you up back from the hotel and taking you to the airport when you're ready to fly home. We understand that this can be a big source of anxiety for people going to Cancun and worrying about how they're going to navigate the airport and get to where they're going. We take all that out of your hands, so there's no guesswork, there's no hassle, and you have safe and reliable transportation to get where you need to be. And really, the service team down there, they provide comfort. They're your point of contact, as I mentioned, in Cancun. They're always friendly faces, really a tremendous willingness to help, and really in the utmost pride in what we do. They are very proud to work for Celltex, and they've seen a lot in assisting our clients down there, and it shows in the way that they treat you, and the extent to which they're willing to go for you to ensure that you're comfortable. So we just want you to know that whether you're in Houston or somewhere else in the US, once you get down to Cancun, we're still here for you. We're still there for you. Stem Cells Cancun clinical staff. So these are the physicians. This is our physician dream team at Hospital Galenia. And these are the physicians who administer stem cell therapy. The first two on the left are really the ones who have been with us since the very beginning, since we began sending clients down to Cancun. Dr. Ana Camarillo, our medical coordinator, Dr. Gabriel Salazar, our medical director. These two are the ones who you hear from the most, as well as Dr. Miguel Ramirez. He's an orthopedic specialist, very knowledgeable in other areas as well. All three of those physicians are bilingual. They will talk to you as much as possible, answer all the questions that you have so that you are extremely comfortable with what to expect from stem cell therapy, both following therapy as well as with procedures. You see Dr. Felix Robles, our anesthesiologist down there, who's been working with Celltex since the very beginning of working down in Cancun, as well as some of our other specialists, Dr. Raul Yuan, Dr. Raul Lopez Serna, who's a neurosurgeon. And I'd also like to mention Jose Oseguera, who is not one of our physicians, but a very, very important member of our team down there. He is the Stem Cells Cancun lab manager, and he works with Candy a lot in ensuring that all of our permitting and protocols are in good standing so that we can continue to do what we do in Cancun. So the Stem Cells Cancun team is all about superior care at Hospital Galenia, and they have the experience and expertise that I would venture to say that very few anywhere in the world can match. Again, led by Dr. Salazar and Dr. Camarillo, they have administered over 9,000 therapies and counting with no serious adverse reactions for our clients. So they've seen it all, and they can speak to you in great detail about any of your stem cell therapy needs. As you saw, we do have specialists on staff. We have a neurosurgeon, orthopedists, specialists in emergency medicine, and cosmetic specialists as well. And we can offer all the following routes of administering stem cell therapy: intradiscal, intra-articular into the joints, intrathecal into the cerebrospinal fluid, intranasal, intramuscular, intradermal, intralymphatic, and intravenous or IV therapy. And they do have sophisticated equipment down there as far as image-guided, fluoroscopy-guided injections and equipment to ensure a very sophisticated experience. And just to give a little teaser, some of these routes of administration will be the topic of our next webinar. So I'll give you the date and time for that at the end. But just so you know, we'll be talking about that a little bit more next time. And as you see here, you've got, we'll go more into the way the rooms are set up, and we've blocked out some of the clients here for confidentiality purposes, but you see a nice, bright, comfortable room there, and a bed next to an IV. You know, that's the majority of what you're having done. Some of the injections and things like that, you may go to a different OR room, but the majority of what's done in the IV therapy is done right here in these comfortable rooms, these comfortable beds, surrounded by a high quality staff. Hospital Galenia itself, a world-class facility. You can see here the outside of Hospital Galenia there, a very modern facility, which is where Stem Cells Cancun, our offices, are located. You can see the cafeteria there, bottom right. Very clean, bright facility. I didn't mention some of my educational background at the beginning, but I did my master's program here in the Texas Medical Center, which some of you may know is the largest medical center in the world. I spent a lot of time in and out of Methodist, St. Luke's, and Texas Children's, MD Anderson, many nationally renowned facilities. And while Hospital Galenia is not as large as those facilities are, I can assure you it's just as nice, just as modern, and just as qualified a staff as you'd find at those facilities. So just to give you a little bit of a closer look, picture at the top right, this is one of our support staff down there. You have a nice open room, clean, private. You see there's a chair and a couch if you prefer to get your IV sitting there in the chair as opposed to laying in the bed, that's possible. There's room for spouses or other family members to be there in the room with you. That's perfectly fine. It's just a nice, comfortable experience. Giving you a little bit more of an idea about some of Hospital Galenia's credentials, because a nice, clean space is all well and good, but we want to make sure that we're working with a high caliber facility as well. So I want to take just a minute here to cover some of the accreditations and certifications that Hospital Galenia has attained. Certificado Consejo de Salubridad General is basically a Mexico-based accreditation, and it establishes that Hospital Galenia contributes to the continuous improvement of the quality of medical care services and the safety provided to patients. The one there in the middle is the big one. For those of you who are familiar with the Joint Commission, that is basically one of the oldest and most recognized certifications or accreditations that one could receive. That's a big one here in the US. So this is Joint Commission International. And this basically says that Hospital Galenia has demonstrated a commitment to excellence in patient safety and care. It serves to recognize that healthcare services live up to the most important international practices. So the Joint Commission International is a huge qualification for Hospital Galenia. And lastly is the International Accreditation Canada, essentially Canada's highest accreditation. So basically, Hospital Galenia has the best of the best accreditations that they can have from Mexico, Canada, and then Joint Commission International, which would be highly recognized by US hospitals here as well. So a very high quality facility. At this time, I do want to play a brief video here for any Dallas Cowboys fans in the audience. You may recognize this gentleman. Mr. Lilly and a few of our other clients are just going to talk a little bit more about the experience down in Cancun and with Hospital Galenia.
Well, when I started out on my first trip down to Cancun for treatment, I talked to the people at Celltex, and they assured me that they had packaged all my stem cells and they were ready to go. We went to this beautiful Sheraton hotel, which joined the hospital, which was brand new and beautiful.
They took care of us from the moment we stepped off the airplane. They were there to meet us at the airport. They took us to the hotel. They picked us up when it was time to go to the hospital. They made sure we were taken care of every step of the way. We felt very safe.
They're very advanced, not like we think here, oh, Mexico is a third world country. That's not what you're going to see. The quality of care in Galenia is very exquisite.
The hospital staff there, very friendly. The hospital's so clean. They come and take care of you and make sure that whatever you need, you have.
We felt very comfortable with the process that Celltex had.
And the doctors, before they put it in the IV bag, they took it out, they showed me the name, the birth date, they had me verify that it was mine on the bag, on the vial.
They used a CAT scan on my shoulder and placed the injections perfectly. and all I felt was just a tiny bit of pressure, no pain whatsoever. I could not believe it. I never had a shot before like that I didn't feel a lot of pain.
Feel like you're going to a spa, do some stem cells, come out, look at the beach, enjoy the weather, and come home. You can't lose in this scenario.
I'd say it's unusual. When you usually think of a treatment, you don't think of going to Mexico to the beach. It was wonderful. It was basically a vacation.
So hopefully that gives you a little bit more of a glimpse into what the experience is like, both getting through the process here stateside and then going to Cancun into Hospital Galenia for stem cell therapy. And now, as we wrap up here, the question that's likely on maybe not everyone's mind, but probably several people's minds, and that is, why do you have to go to Cancun? Well, the FDA views cultured stem cells as a drug. So in order to do therapy here in the US, we need to go through the FDA's drug approval process, which is fine. But many may not be aware how expensive, how long, how cumbersome that process is. So we are working on FDA approval, and in fact, we have 3 investigational new drug applications that have been approved that basically serve as permission to launch clinical trials, which we'll be doing. But in the meantime, as that process plays out, we've established our partnership with Hospital Galenia to give Celltex a trusted partner to make stem cell therapy available to people who need it now while we work through the FDA's approval process, because people can't wait 5 years or 10 years. That's how long these things take sometimes. So it is a little bit of a non-conventional approach to operate on 2 tracks like we're doing, but we are working with the FDA, but we also would like to work with Hospital Galenia as well to make stem cell therapy available to people now. COFEPRIS, on the other hand, Mexico's equivalent of the FDA, has a more favorable view. They view cultured stem cells as a biologic, and they have authorized Celltex to operate under an approved clinical protocol, Hospital Galenia. So we have their blessing to do what we're doing in Cancun, and we have a very strong relationship with that government agency. And just to be clear, other stem cell therapies that take place here in the US are not FDA approved, and they are largely unregulated, and that's just the fact of the matter. Whether it's a same-day stem cell procedure where a physician's working with stem cells from your own body, or a donor stem cell, which is basically an off-the-shelf product from some third-party manufacturer, these are not FDA-approved therapies, and they are largely unregulated. So just because something takes place here in the US does not make it okay. Now, do you want to view our previous webinars? You can go to our website to get some more information about banking and what sets Celltex apart from others, celltexbank.com/banking or celltexbank.com/difference. And you can also view our previous webinars, celltexbank.com/webinars. For taking the time to join us this morning, I would like to extend a discounted rate on our stem cell banking if you're interested in doing that. It is a $5,000 rate, which is $1,500 off the normal $6,500 banking price. And this basically includes qualifying blood work we do through LabCorp, the extraction procedure, which we'll talk about more in our banking webinar, as well as our labs costs associated with banking your stem cells. Costs of travel to Cancun and the cost of stem cell therapy are separate. Now, we're going to start Q&A here in just a second, but I want to give everyone this email address at the bottom of the screen, webinar@celltexbank.com. If you have questions about the offer on banking or questions about your individual condition, please send us an email. I'm going to take some questions here in a second, but I'm going to favor the questions that have to do with the topic we discussed this morning. If you want to know what can stem cells do for my knee, or what can stem cells do for my sister's autoimmune condition, or any number of other individual questions, please send those to the email below, webinar@celltexbank.com, and a member of our client services team will be happy to address those with you one-on-one. Our next webinar will be on Thursday, September 3rd at 11 a.m. again. And as I mentioned earlier, we'll be talking more about those stem cell therapies and those different routes of administration that are offered at Hospital Galenia. Some more details about the procedures themselves, and some of the conditions for which those procedures may be appropriate. We'll jump into Q&A here. Do we have to wait till COVID is over? That is a good question. No, you don't need to wait until COVID is over. We have incorporated COVID testing as part of the qualification process for stem cell banking. As of a few weeks ago, travel to Cancun has been resumed. There's certainly very strict protocols in place as far as everybody wearing masks, sanitation procedures. They're taking that very serious. So we're taking that very seriously as we're transporting people, and of course in the hospital as well. COVID is not a limiting factor. Of course, we all need to be cautious about things, but we are doing testing as part of the qualification process. So you would need to have a negative test at the time of your extraction. And then, you can travel safely down to Mexico as well. How long does the process take altogether? Another great question. It takes, once you've gone through the process of just having the discussions with us and you decide you'd like to move forward, once you sign up for stem cell banking, you enroll, you get your blood work done, and then you do your extraction. The extraction is where the timeline really starts. From the time of your extraction until the time your stem cells are banked takes about 5 weeks. And then it would be an additional 3 weeks to take your stem cells from being banked to get them ready for therapy. So about 8 weeks total initially from extraction to therapy, first time. Once your cells are banked though, you basically, it's only about a 3-week turnaround time to get your cells ready for therapy. Any other questions? How long do I need to stay at the hospital for therapy? Another good question. So these are outpatient procedures. You don't stay in the hospital when you're in Cancun. You can stay at a hotel and we'll transport you back and forth for your procedures. Depending on the number of appointments that are in your therapy regimen will dictate how long you stay in Cancun. For a single appointment, you could be there as short as 2 nights. For something more extensive, 2 or 3 appointments at the hospital, depending on your condition, you could be there from anywhere from 5 to 9 nights. But again, these are outpatient procedures, so there is no staying at the hospital. Who do I contact if I need medical help? That's another great question. As I mentioned, our team down in Cancun, both the client services staff, Eduardo and Veronica, as well as the doctors are there for you. If something comes up unrelated to your stem cell therapy, let's say you get the flu or you fall down and you hurt your ankle, anything like that, you can get in touch with your staff and they'll get you taken care of. Hospital Galenia is a fully functional hospital, so they're well suited to take care of anything that may come up while you're down there. So you are certainly in good hands while you're down there. Take a few more questions. I see one asked about how many stem cells are banked. It's a little bit off topic for this one, but basically a good thing to note about the Celltex procedure or the Celltex process is the fact that from a single fat extraction, our process is able to provide essentially an endless supply of stem cells. We can take a small sample of fat, start with a whatever number of stem cells that varies from person to person, but really that starting point doesn't matter because we can culture into the hundreds of millions, and that can be done several times over. So there's really no limit to the number of stem cells that someone can receive. Let's see here. I think we'll wrap there. Let me just put the back on screen here. There you go. This website here at the bottom, or excuse me, this email address here at the bottom, if you have any other questions, please do feel free to send us an email here. We'll follow up with everyone who is in attendance as well. But go ahead and send us an email and we'll be happy to get you more information. So we'll go ahead and conclude the webinar here. And I do want to thank everyone for joining us. Please come back and join us again on September the 3rd when we'll talk more about some of the specific types of stem cell therapy. And until then, just let us know how we can help. So thanks again, everyone. Have a great day.